The other types of tremor is Parkinsonian tremor. It's very important. We call it pill rolling tremor. It's a resting type of tremor, occur at rest. Can affect the hands, but also affect the chin, lips, legs, and trunk. Can be markedly increased by stress, as any type of tremor will be exaggerated, will be more obvious by stressful condition or emotion. Onset is generally after the age of 60 in patients with Parkinson's disease. Movement starts in one limb or on one side of the body and usually progress to the other side. طبعا إضافة للباركنسون tremor اللي هو arrested tremor ممكن more than 25% of patients with Parkinsonian disease have an associated action tremor as well. طبعا in Parkinson's disease you could see features of Parkinsonism like bradykinesia, rigidity, and postural instability, decreased mental skill, voice changes, or decreased facial expression. نسميه احنا الماسك face may coexist.
Here's a resting tremor in a patient with severe Parkinson's disease. If you look closely, even his left leg has a tremor at rest. The tremor is also seen in this patient's face from the same disease.
Same disease. The other types of tremor is astraxis or flapping tremor. Flapping. يعني مثل اللي يرفرف. رفرفة الجناح is a clinical manifestation in which the hands flap, low amplitude, alternating flexion and extension when the arms are held straight and the wrist in extension. طبعا هذا كلش مهم. التست نسوي in our clinical practice in bedside examination of patients, especially those with liver disease, liver cirrhosis, hepatic encephalopathy, acute liver disease, chronic renal failure, chronic respiratory failure, and even opiate overdosage.
Extend it back like
this
so.
This is the way to examining for flapping tremor.
Then take their hands and push back on the patient's hands, further extending them.
Outstretch hands.
And look for almost like a clonus type movement, an uncontrolled flapping tremor, which may be symmetric in both hands or asymmetric.
So it could be symmetric on both
hands.
You
want to know how long this lasts, its amplitude, and its frequency in your note. Sometimes, in some patients, this tremor may exist simply when they extend their wrists without physician provocation, like this. And they won't be able to fully extend their wrists on one side or both. That is asterixis.
This is asterixis. Other types of tremor is physiological tremor or fine tremor. نشوفها مثلا بثارatoxicosis. Occur in every normal individuals and has no clinical significance. It's rarely visible and may be increased by strong emotion. يعني any person when he is anxious, anxiety or fearing will have a physiological type of tremor. Physical exhaustion, in hypoglycemia, in thyrotoxicosis, in alcohol withdrawal, or even in fever. It can be seen in all voluntary muscles group and can be detected by extending the arm and placing a piece of paper, خلي ورقة, by extending the arm and putting a piece of paper on the top of the hands. It's usually reversible once the cause is corrected. The other type of tremor is the psychogenic or hysterical type of tremor. This is the last type of tremor which can occur at rest or during postural or kinetic movement. Hysterical type of tremor. The features of this type of tremor vary but generally include sudden onset and remission, increased incidence with stress, change in tremor direction, so it's changing in the direction of the tremor or body parts affected, and greatly decrease or disappearing tremor activity when the patient is distracted. Many patients with psychogenic tremor have a conversion disorders, hysterical and other psychological problem. This is the patients with fine tremor. She is thyrotoxic using finger nose test. Perfect. So thyrotoxic patients on no treatment. She got tremor. طبعا تسأل على other features like palpitation, sweating, and etc. The second type of abnormal movement or movement disorders is chorea, dancing movement. Chorea referred to a jerky, brief, purposeless, involuntary movements appearing fidgety, characterized by repetitive, irregular, somewhat rapid involuntary movement that typically involve the face, the mouth, trunk, and limb, and unable to sit still due to disease in the caudate nucleus. Example of chorea مثل Huntington chorea in patients using commonly طبعا نشوفها in patients using levodopa in Parkinson's disease, using phenothiazine medication. Other causes are Sydenham's chorea in patients post-streptococcal infections with acute rheumatic fever. Chorea sometimes we see it with athetosis, fidgety تململ, athetosis, slower writhing, يتلوى movement of the limbs are often combined with chorea and have similar causes. فعادة نلقى chorea athetoid movement. Hemipallismus راح يصير عندنا violent flinging movement of the limb, usually unilateral, affecting proximal muscle more than distal.
My sugar was way,
So this patient
way
with
high
chorea,
for such a long period of time.
he has chorea athetoid movement.
Monday afternoon, I just started gradually kind of losing control of my right side of my body.
نشوف السبيتش مالته ده يفحص السبيتش مالته. نشوف هاي movement في upper limbs
Today are all
exaggerated usually on the right side in this patient. The other important movement disorder is dystonia, which is a sustained involuntary muscle contraction, causes abnormal postural movement. It may be generalized, usually in childhood, genetic syndromes, or more commonly focal segmental, such as torticollis when the head is twisted repeatedly to one side. Dystonia, فعادة هنشوفها dystonia من تكون focal affecting the sternomastoid muscles يصير عندهم يسموها torticollis. It may be repetitive movement or abnormal fixed posture. Dystonic contraction. In Parkinsonism we have flexion dystonia. Dystonic tremor is associated and is symmetrical and of large amplitude. This is a patient with dystonic contractions, very obviously that he was torticollis contraction, dystonic contraction of the sternomastoid muscle with torticollis. Examination for tremor in patients with dystonia, and even you can examine for the gait of the patient. Even during gait you will have this dystonic movement, fixed contraction of the neck.